Brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. Staying in shape is the concern of many of the people these days, and many of the people would spend lots of money just to be in the good shape. Some people, of course, are disappointed by the look of their body, especially those who would gain some weight, ladies who would gain some weight after pregnancy, or people who would have been obese for some time and then they have lost the weight but still have some skin changes and body redundancies. Today we'll be talking about what we call body contouring, and that's the reshaping of the body to be acceptable as we will see if it's acceptable to the patient or the person who has this disfigurement. With us today is Dr. Khalid Sami, consultant of plastic surgery. Welcome.
Welcome.
Body contouring, this word have been being very widely talking about in many of the media shows, and people would spend lots of money just to regain their body shape. So what's the body contouring?
Before this, I have to say that really thousands and thousands of people go under the knife for cosmetic surgery, and this number is increasing every year.
Yes.
And with this increase, there's an increase in the number of questions asked by patients. They want to know every detail, everything about these procedures.
That's
to
true.
talk about body contouring, it's a simple term, but below this term there are a lot of surgical procedures, different techniques that are used to reshape the body. Simply we can say to remove the excess skin and fat that is usually unresponsive to diet and exercise.
Mm-hmm.
This is simply body contouring.
So this body contouring, does it mean that you treat the obesity with body contouring?
No, this is not true. Body contouring is not a treatment for obesity. If someone wants to lose weight, she can do diet, exercise, go to do a bariatric surgery, but I don't advise her to go to a plastic surgeon because these operations are not done for treatment of obesity.
So this is some sort of a complementary surgery to the body loss or body weight loss.
These procedures usually are done after losing weight to treat the redundancy of the skin that happens after losing weight, especially after massive weight loss.
So you said that there are many procedures that we use to do the body contouring. What are the common procedures that we use?
We have a lot of procedures under this term. The famous ones are the liposuction and tummy tuck.
Mm-hmm.
But we have other procedures like we call them lifting procedures like arm lift, thigh lift, and so on.
Mm-hmm.
But the famous, of course, are liposuction and tummy tuck.
The liposuction, would you define the procedure of liposuction? It seems to be.
First, I have to say that liposuction is the most common cosmetic surgical procedure done these days, especially in the United States.
Mm-hmm.
It's a simple procedure in which we just remove the fat layers, the fat from the layers below the skin with a simple technique. Sometimes it's done under general anesthesia and sometimes under local. It's simple, easy, with you can say very few number of complications.
The term liposuction denotes that you do some suction of the fat,
Mm-hmm.
fat, as you said, the fat layers. So the suction of this fat, does that mean that there will be no more fat in this area, and there will it will not recur to the?
Of course, we remove amount of fat from these areas, but I cannot guarantee that this fat will not increase. What I mean, we have a constant number of fat cells, but even if this number of cells decrease, there is a possibility that the remaining cells may, we can say, hypertrophy and increase in size, and we go back to the original condition. So after doing this liposuction, a person or the patient should keep her weight and control that to guarantee that the initial condition will not
I need
recur.
to make this clear, because some people would think if they do the operation, they're never coming back to the because they lost all the fat.
It's not true.
So I need to focus more or come closer to the operation. How generally the procedure is being done?
We have different techniques of liposuction. The most one used today is the tumescent liposuction. We call it the tumescent liposuction. We have other techniques like laser-assisted, ultrasound-assisted liposuction. Let's talk about the tumescent liposuction. In this technique, simply we inject a fluid called the tumescent fluid in the layers of fat that we want to do suction for. This fluid facilitates suction. It contains a local hemostatic that decreases blood loss during the operation, and a local anesthetic to decrease pain, especially after the operation. After this fluid is injected, it's injected through a small incision about 5 millimeter that will not leave a visible scar for the patient. After injection, we wait for a few minutes. Then we start the suction using a specific suction machine. This operation may take a short time, just half to 1 hour, and may progress to 5 hours, depending on the amount of fat to be suctioned and the areas to be treated. After doing this small incision is closed. It will not leave a scar for the patient. This is important to tell. After that, the patient will need to wear a pressure garment for a few weeks. This is simply the operation.
Yes, but what are the commonest areas that you do the liposuction for?
Any part of the body we can do liposuction for, but the most common are the buttocks, thighs. We can say that liposuction may be done alone, or sometimes it is a part of another procedures of body contouring.
Yes.
We can see here in this picture how the cannula used in liposuction, it is introduced into the fat layer, as we see. In this picture, we can see how the fat is almost suctioned. This is the suction machine. It's an old one, but it's one of the suction machines we use to remove fat.
Yes. So you said that afterwards the patient is being able to continue his or her life wearing some garments to just hold. Why would she or he wear the garments?
She's in need to wear these garments to decrease the swelling that occurs after the operation, and to we can say let the skin adhere to the underlying tissues after we remove this layer of fat.
So after this, the patient can go to work after how long?
We can say in few days, in maximum 1 week, she can go back to work and do her normal activity, mostly within after 1 week, mostly within 1 week.
1 week is not too much.
It's not that too much for this. It's simple operation with good results. And now with new techniques, we can do suction up to 10, 11, 12 liters. We do that now.
So you can do from many places. I mean, from the abdominal wall, from the thighs, from the arms, all in a single setting.
We can do that, but there's a danger of blood loss if we are doing suction, especially above above 10 liters and in different sites, because any operation causes injury to the body that will react to this injury through the immune system. So when I do suction in different parts, so the body will react with this immune system to different parts, so the complications will be more, especially blood loss. It's better to do suction for even 7 or 8 liters from one side, better to do a little 5 liters from different
areas
of the body.
This liposuction, I mean, it sounds like magic. You're just not doing a surgery, just a very minute incisions,
Yeah,
and you can go to work after the
it's
operation.
It's simple procedure.
But does it fit for everybody?
No, liposuction does not fit for everyone, and it's disappointing when a patient comes to your clinic and asks for liposuction, and you just tell her you're not candidate for liposuction. You need another surgical procedure. Of those, we call the body contouring. Most of the patients think, oh, I need this simple procedure. I don't want to go to another procedures that will leave a scar, will cause pain. But
Exactly,
not
yes.
everyone is candidate.
So who's more candidate to the liposuction? Who's not more candidate to the liposuction?
We can say it's all about the skin. When we decide, we have to assess the patient mainly skin. Simply, we can say if you're young, your skin is healthy, is elastic, you don't have much stretch marks, and the excess skin is just mild, then you're candidate for liposuction. But if you're getting old, you had multiple pregnancies, you're obese, you lost a lot of your weight. I mean, when your skin is not elastic, not healthy, and the excess of the skin is moderate to severe, then liposuction is not good for you. And even this liposuction may worsen your condition and increase the skin redundancy.
So that means that she or he has to shift to the bigger operation. We have a short break, and afterwards we will be talking about the other kinds of operation of body contouring. Brothers and sisters, please don't go away. We have a short break, and inshallah we'll be coming afterwards to see what else can we do for body contouring. Until then, assalamu alaikum. Brothers and sisters, assalamu alaikum, and welcome back. We're still talking about body contouring, and with us today is Dr. Khalid Khsami, and he is telling us about the different procedures that we can do to regain the shape of the body after losing its contour. Dr. Khalid, we've been talking about the liposuction, and you told us that not everybody can do the liposuction, unfortunately. This very beautiful operation that with no or almost very minute scars can do a great job. So if your patient cannot do the liposuction, they have to shift to another operation. The most common is the tummy tuck. The tummy tuck, we've been hearing about the tummy tuck for a long time. Tell us, what's the tummy tuck?
Simply, tummy tuck is a procedure done to reshape the abdominal region, to make it firmer, flatter, and to make a slimmer waistline. Simply, after multiple pregnancies, again with obesity and massive weight loss, the skin of the abdomen becomes redundant. And especially with multiple pregnancies, the abdominal muscles become weak, and these muscles need to be tightened and strengthened in this operation.
Yes, so we have the problem in two areas. The fat of the skin
and fat
and
layer.
the muscles itself.
We are dealing with the two layers. We do excision for the skin and fat that is in excess, and we treat the muscles that are weakened by the previous causes.
Yes.
Simply, when we talk about the operation, it takes longer time than liposuction. It requires stay at hospital for a longer period, and return of work will be later.
A little bit delayed than the liposuction. So how is it done generally? I mean, roughly for the patient.
This operation is done, of course, under general anesthesia. Usually, the patients ask for this scar. Will it leave a scar? I have to tell you, it will leave a scar. and this scar is a long scar along the suprapubic area. But I have to say that
that's the lower area of
lower area of the abdomen,
just under the belly.
just above the pubic area.
Yes.
What we do is we are trying to hide this scar so it will not be visible under the bathing suits and undergarments. It is hidden. Yeah, it's a long scar, but usually it is hidden. No one can see it. Simply we can say that after we do this incision, we separate the outer layer, skin and fat layer, from the muscles of the abdomen, the vertical muscles of the abdomen. Now, in this figure, we can see this is the site of the incision. These are the muscles. This is what we call the skin flap that we separate.
So now this means that you've peeled off the whole skin of the abdomen all the way up
to the costal margin, to the ribs,
to the throat, to the to the chest.
Yeah, to the costal margin. We elevate this flap to the costal margin. Now we can see the muscles. In these patients, the muscles are weakened, and usually what we see here, the vertical muscles here, are usually separated from each other. This is what we really do. We tighten these abdominal muscles to decrease the width of the abdominal contour. We decrease this width to produce a slimmer waistline.
You take sutures in the muscles.
Sutures, yeah. In this picture, we cannot see this separation, but in fact, these muscles are not like that in the middle line in these patients. This is the final result we get after doing the sutures.
Usually they're more separate than from each other.
They are more separate. After doing that, this skin and fat is stretched, the excess skin is removed, excised, and this suture line later on is closed with sutures. It's important to tell the patient that tube drains will be left for a few days after the operation. This is very important to prevent any fluid collection under the skin.
And the patient would stay in the hospital for how many days?
Usually, she will stay at the hospital till these drains are removed. It takes 2 or 3 days maximum.
So afterwards, the patient has to wear also garments,
especially in this operation. I need to wear garments to decrease what we call the edema, or the swelling of the tissues. Number 2. We have done separation between the 2 layers of the abdomen. I want to make them adhere together again, so I have to wear this pressure garments for a few weeks. Again, the patient can go back to work within 1 to 2 weeks. Usually, you can say 10 days.
10 days. 10 days is not too much. If she or he would have a big belly and then they just wasted or lost the belly.
Yeah.
But does that need extra exercises for the abdominal muscles after that?
We already tighten these abdominal muscles, but as we said before, I cannot guarantee that your abdomen will not become pendulous and your skin will not become redundant again. If you keep your weight, if you control your diet, if you do exercise later on, we can guarantee that this operation is successful.
So, some of this tummy tuck technique, we can do it also in other areas of the body. I mean, the arms, the legs, the buttocks.
We do some what we talked about before, the lifting of different parts of the body, like the arm left, thigh left. It's the same. When we have redundancy of the skin in these parts, we do excision for the skin.
And you can do it symmetrically. I mean, if you have one arm, you have to do it on both sides.
Of course.
And you can do it also with the tummy tuck operation.
Yeah.
At the same time.
But as we said before, when I'm doing this in multiple areas, I have a problem with blood loss. I can say that there will be a longer hospital stay, and the return of work will be delayed for more than 10 days if I'm doing this excision procedure or lifting procedure at different areas.
Some people would have this, especially the ladies after birth, giving birth for many children, they would have these stretch marks and these dimples. And would these operations treat these problems with they have?
I don't think they improve the cellulite and stretch marks. Many think that, especially liposuction, they always come and say, I want to do liposuction for stretch marks, I want to do liposuction for cellulite. This is not true. There are other treatments for stretch marks and cellulite. We have some devices like ultrasound, LPG. We have other treatments. And I have to tell the patient that stretch marks and cellulite are difficult to treat. So not this only operation will improve her condition.
But ladies would be very much worried about these marks left by these stretch marks and this afterwards the coloration it leaves. Some would use the creams and they're not very efficient. So you said there's some,
as I said, it's difficult to treat, especially stretch marks. Stretch marks could be treated when early they appear red before becoming white. Usually they improve as long as they are still in this stage, as long as they are still red. We have different types of treatments, especially now the fractional laser. We use it for these red, especially stretch marks.
Some ladies or guys, but it's more common in ladies that they would have some flattening of the skin, the opposite of being fat, the flattening of the skin, and maybe especially in the areas of the face, just showing the bones, and some would have this injection of fat. Would you tell us about this?
This augmentation of these areas could be done using fat, as you said, in a procedure close to that of liposuction. We do liposuction with a special technique from the abdomen, from the buttocks, thighs, and we take this fat and inject it in the areas to be augmented. But recently we have things less than liposuction. We don't need to go to the operating room to do this. There are simple injections injected these days, like what we call fillers, hyaluronic acid fillers. We have different types of these fillers that are used instead of doing an operation. These fillers or these materials are injected at the clinic. We have just a problem that these substances are degraded by the body, so you have to inject them regularly, between 6 months to up to 1 year.
Would the fat stay longer than these
fat
materials?
Stays longer, but we expect that about 50% of this fat will be also degraded by the body. We call it a fat graft. When we transfer the fat cells from one side to another, some of these fat cells will survive and others will be dead. Those fat cells that will survive will go good and for a longer time than that with fillers.
So at the end of our episode, I need you to give an advice to those who would be interested in their body shape and body contouring.
I have to say that this is not the only thing that will make you beautiful. Many people say, I'm too skinny, I'm too fat, I'd be happy if I'm taller, I'd be confident if I lose some of my weight. This is not the idea. You don't need to change how you look to feel happy and satisfied. I think you need to change the way you look at yourself, the way you see your body, and the way you think about yourself. That's how you could be happy and confident.
That's very true. Dr. Khaled Sami, thank you very much for being with us today.
Thank you.
Brothers and sisters, it has been a pleasure to have you with us today. We've been talking about body contouring. Please don't forget to write to us. Our email is health@huda.tv and our website is www.huda.tv, and our new Facebook page is facebook.com/health.huda.tv. Until next time, I wish you a very good health, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.